we've developed a technology that enables sort of this real-time continuous sensing of any analyte in the interstitial fluid. And that means glucose, potassium, creatinine, lactose, urea, alcohol, and CGM as for continuous glucose monitoring. But we like to call this CXM, continuous health monitoring.
Hello and welcome, it's Camille, No Diabetic, your diabetes tech guy. If you're new here and want to follow along for more videos about diabetes tech, I would love for you to subscribe. In today's video, I am interviewing founder and CEO of OneDrop, Jeff Dachis. We are discussing everything from what OneDrop is doing today and what they've got planned for next year. As with every single interview, this video is not sponsored, and I hope you enjoy. Here is my interview with Jeff. Jeff, thank you so much for being here. For viewers who might have not heard of OneDrop before, can you give us a 30-second overview of what you do?
Sure, Camille. And first off, thanks so much for having me. At OneDrop, we've created a groundbreaking sort of category-defining company that delivers precision health through AI, not RX. And we're bringing together a set of groundbreaking technologies in both our biosensors as well as our artificial intelligence predictive algorithms. And we're doing it to serve a massive market opportunity in precision health. The system is broken. I know firsthand, as well as you do, as a type 1 diabetic, how difficult it is, to manage the day in and day out experiences of having type 1 diabetes. And for the most part, that same set of problems that we experience each day is present for almost everybody that has a chronic condition. And so with OneDrop, we're kind of bringing together, health sensing, artificial intelligence, and telehealth into, a single precision health platform. And, that's really what we do. So
you started as a software company. So you started with an app and a coaching platform. Moved into hardware with your meter, which I like. I use it. I'm a big fan. And you now really work in the software space again with some of the AI algorithms that you do. So today in 2021, would you define OneDrop as a software company or as a hardware company?
That's a great question. And what we always like to say, which is the truth, is that we're a combination of hardware, software, and service.
I read something that you said a while ago, that one of the reasons why you went into hardware, into making a blood glucose meter, is that you experienced difficulties collecting data from other device manufacturers. Mm-hmm. And so if you had to, if you were started OneDrop again today, second drop, you have no idea how proud I was of that when I wrote.
Yeah, you got that. You got that one in there. That was good.
You have no idea. If you were to start second drop today, do you think the industry would be different? Do you think they would be more open to having a digital app which connects to a blood glucose meter or a CGM?
Not particularly, no.
Okay.
Healthcare and diabetes in particular is one of the most sort of insular and silo-based, industries I've ever worked in. You have too many manufacturers that believe that their thing and only their thing should only work with, the things, they're not sharing their data. They're not being open about the way their data gets utilized. And so from our perspective, we were not willing, because we are a data science driven company, because everything we do is rooted in the predictive capability sets that we're able to derive from the massive, now 26 billion health data points that we have from millions of users in 195 countries, utilizing OneDrop in 11 languages. We have all of this contextual data, and there's no way that we would be getting that data without, establishing our own sources of data and our own relationships that way.
That makes a lot of sense. And actually, let's actually move on to data science. What are you predicting? What data are you collecting from users, if I can word it like that? And how does that enable you to help someone with their chronic condition management?
Yep, that's great. First off, I just want to re-articulate the vast sum of data that we have today, and how it really impacts how we get predictive power out of it. Again,
is it 1 billion data points every 3 weeks you get? That's the stat that I got.
Today it's 1 billion data points every 3 weeks. It took us 3 years to collect the first 1 billion data points, and now we're collecting 1 billion data points every 3 weeks.
Wow.
And really, and just by comparison, just to throw it out there, a company like Omada that you've heard of, I'm sure, has about 4% of the amount of data that we have. And another company you might have heard of called Livongo, at the time of their merger with Teladoc, 2% of the volume of data that we have. And so just by comparison, some of our competitors, some of the great companies that are doing great work in the space that you know of, has that amount of data about just small aspects of their users. And really the power of our data lies not only in the massive amounts of data, but because that data can train our artificial intelligence algorithms, and you need a ton of data to train algorithms, but that we have a huge breadth of data, contextual data. So, and that contextual data allows us to understand not just what happened, but how it happened or why it happened, right? If you just show me blood glucose readings, and I have a ton of glucose data, awesome. But if you can't show me what somebody did to get to that glucose reading, maybe they were exercising, maybe they were sleeping, maybe they were stressed out, maybe they were moving away from their house, maybe they, we know a lot about people like you. And so the pooled set of data helps us understand where a situation that you're about to enter into right now, whatever that situation is, it's likely there's somebody that's had a similar situation or something very close to your situation in the past, and we can use that pooled data to predict what's going to happen to you next. And that's really where the power of our data platform gets interesting, because of the massive amounts of data, because of the contextual sort of sources of data that we have, that data becomes very predictive. And that's wildly different than what you see anywhere else in diabetes or in chronic conditions. And if you imagine that somebody's giving us their heart rate data or their activity data or their pulse oximeter data or their blood pressure data or glucose or food or stress or sleep, all of that information allows us to help people with chronic conditions stay healthier by giving them insights as to what's going to happen. And let me give you just a simple parallel. When you get into the car, you have GPS, which has already mapped, where the maps are. But in addition, your car also has collision avoidance sensors in it. And so you wouldn't think about getting in the car without that sort of instrumentation and capability today. But we drive our bodies every day. Every single day, we drive our bodies with no ability to understand what's ahead, what's going to happen to me, and how can I stay on the road to safety. And really, that's what OneDrop's bringing now. It's bringing all of that sort of, it's a lot to think about, all the data science and all the data and all that stuff. It's a lot for somebody to think about. You turn that into an actionable insight for someone to say, this is what you should do right now to stay safe. And that's what OneDrop does.
So actually, let's carry on this road analogy. Let's drive it forward. I'm so proud.
You're so good.
Let's drive it forward. Give me an example of what kind of insight someone. So I think we should clarify, because so for your 8-hour predictions, for example, that's currently, it's been CE marked over a couple of weeks, and that's for type 1 prediabetes and gestational diabetes. So not type 1 for now. What kind of insight are you able to give someone? And is it more, is it medical advice, kind of, consider taking insulin? What kind of action can someone take from that, avoidance collision system?
Yep, that's a great question. So today, or since 2018,
Right.
since 2018, OneDrop has had the first and only glucose predictions in market. We today have those glucose predictions up to 8 hours in advance for type 2s. And the type of prediction that we'll give you is one that is largely related to where your, obviously where your blood glucose is going to go. So as example, your glucose is going to go up soon, but not too high in the next 3 hours.
Right.
We're telling you what's going to happen. And we
Right.
won't tell you what's going to happen unless we're confident that that's what's going to happen.
Right.
And then we'll say, take a 15-minute walk. That'll help you bring that glucose down. Or eat an orange, and that'll help bring your glucose up. Or a variety of thousands of other actionable insights that you can take based on these predictions. And so none of those are medical advice. None of them. We will not tell you to take insulin. We may suggest that you talk to your doctor about taking insulin, but we won't say you should take insulin right now. So we won't provide any medical advice attached to these predictions today. That's glucose 8-hour forecasts. We also have CGM forecasts that are built and ready to launch, but we're waiting to find the proper regulatory pathway for them. And that CGM predictions are really for type 1s. So BGMs for type 2s today. And then we have a CGM algorithm today and set of insights that are already built and ready to launch, but haven't launched yet. And then we also have now blood pressure insights, which have been launched and also have been CE marked in Europe. Soon you'll see a variety of other types of predictions, blood pressure predictions, weight predictions, heart rate predictions, et cetera. There's a whole arsenal of algorithms and insights that we've created that we're slowly figuring out what's the best pathway to introduce them into the app experience to make sure, one, that we're complying with all regulatory frameworks all around the world where we operate, but also that we're approaching things with safety and the user in mind.
Gosh, you're really full speed ahead of those 26 billion data sets. So actually on that CGM, on that CGM point that you raised, so would that be aimed at type 1s? And if so, I would assume that their prediction would be much shorter because it's impossible to, I can't see a way currently to predict my glucose 8 hours in advance without knowing what I'm going to be doing for the next three hours, right?
Those are 1 hour, 2 hour, or 3 hour predictions, and then also overnight hypo alerts, which are ready to go. Yep.
Amazing. Staying with data science, one area that I see a lot of machine learning AI type companies lose focus on is the quality and the diversity of data. Because I think we've all seen terrible examples, and this is a very different field, but just to illustrate the point of the Twitter algorithm always focusing on a white person's face, not a black person's face on
inherent bias in AI.
Inherent bias in AI. So when you make such data sets, what has your kind of point of view been on this to ensure that the data that you collect is diverse enough so that everyone using it has a meaningful experience?
Yeah, and that's a great point and a great question. And let me address just one other point really quickly as well around data security. We take data privacy and data security extremely serious, and it's very important that everybody knows when they use OneDrop, one, that their data is safe and secure. Two, we will never sell it to anybody or give it to anybody else. And three, that the trust is at the core of what we do, in that if you're giving your data to OneDrop, we're giving you more than we're getting. We're giving you more insights, that everybody on the platform is helping everybody. We like to say we're all in this together, because it's really important that we really are all in this together. It's tough being a person with diabetes or a person with chronic condition. You know, it's really important that we can rely on each other and trust each other, and that's core to everything that we do at OneDrop. As it relates to inherent, sort of bias in the data sets, we're working with a very large and diverse data set. So it comes from, again, millions of users in 195 countries utilizing OneDrop in 11 languages. It's really based on years and years and years and people all around the world, utilizing OneDrop. So we feel really good about the diversity of the data set.
Amazing. And on the privacy point that you raised as well, so it's the data is anonymized on the user level.
Yes, for the most part. I'll caveat that with say we do have this community function called the OneDrop ambassadors, where you can apply to share your data publicly as an identified person. So like, I'm a OneDrop ambassador. So if you go into OneDrop, you can see my whole blood sugars, what I eat. You can see the medications I take. You can see when I miss a dose or whatever. You can see it all. It's and it's a way for us to showcase all of the all the flavors of people with chronic conditions. I mean, some people are well managed, some people are not, and that's okay. It really is okay, and we can all really learn from each other. Again, we're all in this together.
And I couldn't think of a better way to end data science than that. Okay, another topic that I want to move to, which you touched on briefly in your intro, health sensing. So I'm going to read directly from your PR statement. Multi-analyte dermal sensor. That's very difficult to say.
Exciting.
The biosensor with continuous health sensing capabilities. Talk to me about that. What hardware platform are you developing, and if you can share, what data are you hoping to be able to measure?
Sure. I mean, I'll tell you what we can tell you, and why it's exciting. We've developed a technology that enables sort of this real-time continuous sensing of any analyte in the interstitial fluid. And that means glucose, which we measure very effectively and accurately in the interstitial fluid, but it also means a variety of other things like potassium, creatinine, lactose, urea, alcohol, hydration. There's a whole bunch of things that we can measure in the interstitial fluid. And then on top of that, if you pair that with a heart rate, PPG, EKG, activity tracker, you can start to measure sleep, stress, blood pressure. You can impute blood pressure, and heart rate, and a whole bunch of other things. And so when you start to marry a variety of different chemical sensors in the interstitial fluid, sensing capability in the interstitial fluid, with optical and electrical sensors like heart rate or activity, you start to get a very diverse picture of what somebody's doing. It's like putting a lab on somebody's arm. And CGM as for continuous glucose monitoring, but we like to call this CXM, continuous health monitoring, where that X equals anything that we can capture with inexpensive sensors. And so as you start to think about that, our platform is intended to be daily wear, no needles, no 14-day commitment in industrial adhesives that are giving you rashes and leaving black gunky stuff on your skin. Very accessible pricing, and then we're trying to get it down to a cost per wear that's, I'm going to say, consistent with BGM, and that we're looking to eliminate the finger stick for the broad population of people with type 2 diabetes, with prediabetes, with less intensive insulin managed diabetes, that really are locked out of the ability to use CGM today. That's the market that we're going after. Okay.
I love this CXM. I think that's Fantastic. Let's unpack some of that. And if at any point I push you, just say I can't talk about that.
Yep.
The couple of key words that you said, which I thought were fascinating. No needle.
Nope.
So
well, let me caveat that.
Yeah.
The platform, the sensing technology that we use is called a microneedle array.
Right.
And so let me caveat that. They are
Right.
microneedles. They're about 400 microns, or about a half a millimeter. And so there are microneedles.
But very different from what we know today as a CGM platform, which I would agree with calling that no needle, because microneedles is something completely different. To everyone, I in the video I will put some pictures of microneedles in the video so people know what we're talking about. But yeah,
I mean, but to be fair, you know, the players that you know in the marketplace, and thank goodness for them, by the way, they're doing an amazing job. Dexcom, Abbott, Medtronic, Senseonics, fabulous job meeting the needs of the highly intensive insulin managed type 1, like you and me, right?
Yeah.
You know, undeniably amazing technology. Those companies are so well run. They're managed by great management. They're really doing a service to everybody. So we want to give them hats off, you know, tip the hat to them. Amazing work. Where we think there's work to do, and the place that we like to, you know, get to, is a place where the less intensive insulin managed individual, or the non-insulin managed individual, or the person who's trying to lose weight, or somebody with cardiovascular conditions, or prediabetes, or renal care, or performance athletes, or a variety of other people, continuous CXM, you know, is just a different animal. And it's really important for us to make sure that affordable, accessible CXM is available for everybody, because that's how you get to precision health for everybody.
Yeah, I think accessible is definitely a key. I mean, you know, even in 2021, CGM is still not accessible to the vast majority of even intensely managed people with diabetes.
Correct.
So and we nowhere near even considering, you know, type 2s, pre-diabetes, and all of those other conditions.
Correct.
Its access is a huge, well.
And I think when you have a product that's priced so high, you know, you really need insurance reimbursement to pay for it. And the game for the highly intensive insulin managed type 1 companies is to ensure that they get the, you know, that they're getting insurance to pay for those high priced products. And really, as you start to look to bringing in products that can be less expensive, both because the way they're designed, but also because the way you can configure the wears. So for example, if I have to have a sensor that's on me for 14 days, I've got to make sure that I'm capturing 14 days worth of value, right? But if I can configure a sensor for a type 2 diabetic or a pre-diabetic that only gets worn 7 days a month or 7 days a quarter,
right?
You know, now all of a sudden, you know, we can bring the price for that type of user down, you know, to well below what the cost of EGM is. And we can get the same kind of benefit and value, you know, from a continuous experience in those shorter windows. And so there's a lot of flexibility that lower pricing brings. And I think, you know, that's really where the industry needs to go, so that we can get to precision health for everybody. Accessible, affordable support for precision health for everybody.
So a brand new product category, let's define it as CXM. Do you see CXM being prescribed, or do you see it being consumer healthcare, like Apple Watch style, where you have all these metrics which are measured for you and analyzed in the background, but you don't need a prescription? I have ECG on my watch, for example, right? And I don't need a prescription for that. Do you, where do you see CXM develop, whether that's your CXM or just the market in general?
Yeah, I think that's a great question. certain configurations of the sensors will require different types of either prescriber pathways or OTC or over-the-counter pathways, right?
Right.
And so, as an example, if you're just talking about, let's say, a lactate and temperature sensor, my sense is that there's really no health risk, to that type of sensor that you'd apply to your body. The same way that there's no real health risk to having an Apple Watch or a Fitbit or Lose It or Runtastic or some of the other apps or a connected scale. It's not something where you're going to need a doctor to prescribe it and ensure the safety of and efficacy of that product for that individual because of what you're sensing and the risk to the individual for having that information. As you start to move into riskier categories where a person may be using a drug like insulin based on the information that they're receiving, my strong desire is to ensure that those products are prescribed and that a doctor is making sure that there's safe and effective use of the product. And I think what's unique about our platform is that we can do both.
So your CXM, would it be I hope you can say at least that, would it be a single product which measures all of those things, or would there be different, like you kind of said, different kind of sub addition, if you like, for different chronic conditions or different people? Because we're talking about so many sensing abilities, like the alcohol, for example. I don't know a sensor today which can sense that. Maybe I'm not into, I do drink Chardonnay, but I've never, okay, right. But I've never heard of a sensor capable of doing that. So can you say if it would be kind of one all-in-one sensor or different versions of it?
So you may see over time from us, I call it a multi, like a sensor that has, call it everything, all the kinds of things in it. My sense is, I don't know how useful that is for everybody. If you're trying to lose weight, as an example, there are probably a specific set of sensing modalities that are best for you. If you're trying to be a performance athlete where you're optimizing the glucose and lactate in your body, that looks different than somebody who's trying to manage their type 2 diabetes.
Right.
And that may look different than somebody who's managing their type 1. Or let's say you're giving it to all transportation workers on the trains in your country because you don't want them drunk while they're operating the train. You'd use an alcohol sensor and something else to real-time monitor the CXM sort of capabilities of that particular organization. Perhaps your military personnel wear CXM to measure the stress and the cortisol or the, I'm just making some stuff out, the hydration, so that you've got a squad out there that's doing, the best that they can. Perhaps you have firemen or first responders, police squad that's out there, and you want to know who on your team is gonna bork, and lose steam. And so it's really important, I think, for us to think about CXM as a flexible platform that can be pointed in different directions, but I wouldn't do it all at the same time.
Yeah. Wow. You as long as you said train, I'm a massive train spotter, so you sold it to me at that point. Wow, I never thought of that ongoing alcohol monitoring point. But it's wow, mind blown, quite literally.
I mean, when you think about the success that we've had with CGM, again, some of these great companies that we've talked about,
right?
It's mind blowing to think that we drive our bodies, to use the transportation metaphor again. We've been flying blind. I mean, the fact that you'd give somebody a deadly drug like insulin and not give them the instrumentation to understand what it does and what happens to them when they do it. Like,
right.
It's bizarre to think that we have been have been operating our bodies like this for centuries, or since time began. Now we have the opportunity to instrument our bodies in real time, and to be able to take that instrumentation and understand what to do with it to stay healthy, versus treating us after we've gotten sick and crashed the car, to use the metaphor again, right? That's what we do in diabetes, right? We get sick, we go to the hospital. Like, well, why did it happen? How could I have prevented that with continuous sensing and artificial intelligence? And that's really where OneDrop plays.
Wow. And I think one of the public PR statements that you guys had, or job things, I read 2022 as some of the, is that you're expecting to launch into next year, right?
Yep. We're on track.
Well, you're on track. Wonderful. Well, I will invite you back next year and we can talk about it in more details then. That was actually incredibly insightful. Well, to close off, my final 5 rapid fire.
Okay, I'm ready.
On a scale from 1 to 10, how happy are you with your app today?
8.
If your research and development budget doubled today, what would you do that you currently are unable to?
The company's very well capitalized right now, so I'm feeling pretty robust in terms of what we're spending on R&D. In all honesty, we're hiring so many people right now. I honestly would invest more in recruiting to bring on more people. We really cannot staff fast enough. That's
a very interesting point. Actually, no one has always been kind of actual product related things. That's interesting. When you retire, what do you hope your OneDrop legacy to be?
I hope I don't retire. And yeah, I'm hoping OneDrop is a generational kind of company that can outlast anything that I would ever contribute to it, and be helping the 1 out of 3 people on the planet with multiple chronic conditions, and the 1 out of 2 people in the US with chronic conditions, to gain the benefit of precision health.
4, Apple recently launched health trends and glucose trends, glucose highlights. Do you see Apple as a threat within healthcare long term?
Again, never underestimate Apple and how good they are at what they do, because they're really phenomenal, and we could never, it could only aspire to be as good as they are. But I will say that we are a partner of Apple, and we believe that we play very nicely alongside of Apple, and I'm hoping that that continues to be the case for as far as we can see. I know Apple is doing an amazing job at getting people to pay attention to things that they might not have had access to in terms of information, and we believe the same thing. We're just bringing a whole complementary set of information to the table, and so again, we play very nicely right alongside Apple. I do think Apple's going to be continuing to invest in their health initiatives, and I think they're going to be doing a great job. I have an Apple Watch. I'm sure you do too, and it does a lot of stuff. There's a bunch of things that it won't do, and I think we will do. And so again, I think we're going to play very nicely alongside them. I don't feel threatened by Apple. Your
OneDrop meter is to date the only diabetes hardware product which connects directly to the watch. Can you, this is a quick follow-up on the Apple subject. Can you share what the utilization of that has been? Have you seen a lot of people connecting their meters to the Apple Watch directly? Do you have data on that kind of stuff?
Yeah, I don't have any statistics for you, but I know that it's very popular. Right. That people with diabetes who are on the go and who don't necessarily always have their phone, which today all of the other diabetes products that connect to the Apple Watch do so through your phone. We are the first and only company that has connected a glucose meter to the Apple Watch, and it's exciting. I don't know if it'll always be that way, but yeah.
With a lot of respect, I hope you won't be the only
Yeah,
one.
I hope we won't be too. Exactly.
Yeah, I have a huge respect, but I hope others will join soon.
Me too.
It's been kind of very funny to see others really struggle, and I will leave it at that. And final, how would you? This is just beyond OneDrop, just health and generally. How would you rate cybersecurity of phones today as medical controllers, for example? How would you? Do you see phones as being cybersecure devices today?
Let's see. So yeah, it's a broad question. There's a stark difference between the Apple infrastructure on the iPhone and its cybersecurity and the Android system. And so let me just say there's a wide berth there in terms of security due to the way that the app ecosystems and the operating systems are structured. However, I do believe that the mobile phone should be the smart controller for health devices.
Mm-hmm.
And as you get into medical devices, I also believe that the phone provides the compute power necessary to and the data and communication infrastructure necessary to be the hub for for a variety of different devices, medical devices.